Night Health continues. I'm Mark Alyn. During our second hour, David McCullen will be calling us from Tasmania. We've never had a call from Tasmania, but David McCullen will be calling. He's the CEO of Sufferfest, and we'll be talking about the Davis Phinney Foundation for Parkinson's Disease and Research. That'll be happening during Hour 2 here on Late Night Health. We go back to Karen Howard, the CEO and Executive Director of the Organic and Natural Health Association. Karen's a results-oriented person. You take no prisoners, do you, Karen?
It has been said.
In the couple of years that I've known you, you take no prisoners, which is good. How
too much to get done in this world? We've got a short amount of time.
We can sleep when we're dead, right?
That's right.
Right. Though sleep is important, do not short yourself. You need 8 hours a day.
That is also true. Yes.
Right. And the what are some of the other areas that you think will happen, that you suspect will happen regarding supplements for the American people under the Trump administration?
Oh, wow. So that's a crystal ball I'd like to own. Every day is a new day. I'm not really sure how to answer that. I mean, I think, like I said, I think there are some opportunities for industry to get together and really dive down deep and say, look, we have at least a couple of years of an organization and an administration that's, quote, pro-business. And there is that one little glimmer of what does that mean when you look at what he's done in terms of the vaccination council that he's appointed one of the Kennedys to, and what does that mean? Does he really think this guy is a proponent of how vaccines cause autism? So there's so many mixed signals in this that it's worth really looking at hard and saying to some of our supporters, and of course continuing to build support with this Congress, lots of new people. Nobody knows what DeShay was. Nobody wants to talk about 1994 anymore. And just say, how is it that we can build a conversation around what benefits consumers, what benefits companies that are doing this work? And I think so. I really think the onus is not so much on this administration, because it will do what it needs to do, and it will get to us if it does over time. But really, how we can help shape the conversation from a more proactive position.
Can people get involved? Can regular consumers who even take the multi every day, can they get involved and do something to petition Trump and his administration to make the rules for supplements more viable for everybody?
You know what? Absolutely. And I think it's early right now to know what those actions are. I mean, everyone wants to know how to be an effective person in the conversation these days. Activism is at its peak, and I love seeing that. We just don't have anything to grapple with right now. We've got a change in Congress, a change in leadership. It's only been 3 weeks, not even 4, or maybe close to 4 now. And I think we're going to have to be patient and wait to see what those pressure points are. I think it will be hard for us to imagine what the conversation is before we get at least an inkling, before we get interviews with the commissioner of the FDA, in front of the confirmation committee.
But we do know that President Trump is a junk food junkie. I mean, he's admitted that.
But so is President Clinton.
Yes.
I mean, and Andy owned an MLM, so we know that too.
Right. So we have to be very hopeful that he will give the same benefits toward supplements that he apparently will do toward pharmaceuticals.
And that you want to use logic around these comments, and I get that. Oftentimes the logic just falls apart. So I don't, I can't feel real optimistic, nor do I feel pessimistic about the conversation, because I feel like we just don't have a very strong sense of what that conversation is going to be. Now, looking at the rumored candidates, one's, pretty much in the pocket of pharmaceutical world. They don't really need to prove anything. Once they say it's safe, put it on the market. We've seen deaths happen over that. Another one's a tech guy. So that doesn't tell us very much. Well, and then we have the FTC that we have to pay attention to as well. So I think we're all going to be pretty busy over these next few months sorting things out and figuring out what our best decisions are.
At trying to figure out what's best to do.
Yeah, what we're facing.
Is this in your 30 plus years of being on Capitol Hill? Is this the most confusing time for you?
Yes.
Well,
every day I wake up and say, "Wow, didn't see that coming." Yes, it's a journey, and it's an interesting journey because I think that it gives us just really strong opportunities to do some unusual things. And I was just going to say that vitamin D has also been shown to help with depression. So you know, and a little bit of confusion to bring it back to the vitamin D. Karen, thank you very much. We look forward to our next conversation. I will reach out to you at the end of the week. Karen Howard, the CEO and Executive Director of the Organic and Natural Health Association. You can visit them and learn more about them by going to www.organicandnatural.org. Organicandnatural.org. All right, Late Night Health continues. Don't go away. More coming up. We'll see you just around the corner.